Good afternoon, Dr. Frankovich.
Hi.
It's June 24th, and we're here for your media availability. We've gotten some feedback from people asking if you could take off your mask during these media availabilities. Can you speak to that?
Sure, and we've talked about this, but the problem is that the health department is structured. We do not have large spaces here. We're sitting and doing this interview in a small office, and there really is no way to socially distance and do the interview. So I really do need to wear the mask. However, we will try and perhaps do one or two of these outdoors, and we'd be in a different position.
Many people, both locally and across the country, are shunning face coverings, claiming they're not effective, not necessary, and or a violation of their civil rights. Yesterday, you said it's time for the community to depend on personal responsibility. With the prevalence of these attitudes, how do you expect that approach to be effective?
Well, it's challenging, certainly. As we all know, face coverings have become very controversial. I do want to point out that there is growing evidence of effectiveness, and certainly if we simply look at places that have really embraced masking as well as all those other measures that we talk about in general have done better. At this point, we need to use every tool at our disposal. To the question of personal liberties, I would say that we as a society make compromises on these all the time. We do this when we wear seatbelts. We do this when we obey speed laws. It is because there's a common benefit to us all to doing so. And I would argue that in this case, it is really the same. There's a benefit to our community in terms of safety to doing this thing, which is simple and is not costly and really is a benefit for all of us. So, I don't know how people will move forward with this. I'm hoping that they embrace the fact that this really is going to be largely driven by how the community behaves. We can build all the response tools that we want, but in order for us to reduce transmission overall, we really need these measures in place to be effective. So if people want us to be able to avoid as much as is possible large surges in cases, we need to use these tools. It's just that simple.
Thank you. We've heard from several people that the turnaround time for tests at the Optum site recently has been a full week. In recent weeks, what has the average turnaround time been for those tests? Are you concerned about the infection implications of such long lag times?
I'm certainly concerned, and that's why when we are testing specimens on individuals that we have concerns about, either because they're symptomatic or contacts of a case, we try to always do them in our own lab so that we have a fast turnaround time. That being said, for the surveillance testing and such, where there's a lower probability of a positive test, we use the Optum tool because that just is useful to us to be able to get the testing done. It is not ideal. I know they're working on improving the turnaround times, but currently I would tell you that we see turnarounds anywhere from 2 days to 6 days on these tests, and we are on weekly calls with the test center and really trying to get these issues addressed. But it's a work in progress for sure. And yes, it does cause concerns because any delay in identifying a positive, creates more possibility for transmission. So our goal is for everything is a 48 to 72 hour turnaround time if we can achieve it.
As of yesterday, Public Health had classified 103 local cases as recovered, which we understand to mean they meet CDC criteria for no longer being contagious, but some in the public take that to mean they have returned to full health. Can you generally explain the various health outcomes of these 103 patients? For example, how many have returned to pre-infection health and how many have lasting COVID-related health impacts?
Well, I will tell you that we basically, from a public health standpoint, we follow these individuals until we take them off of isolation. At that time, some individuals may still have some mild residual symptoms, and we do not follow them out until those symptoms completely resolve. That actually is the role of their clinical primary healthcare provider. Clearly, there's research being done nationally on how much we may see in terms of chronic health impacts from this virus, but it's not something that's done at the local level.
There is a growing data set nationally to show that Black, Latino, and Native populations are suffering disproportionate impacts from COVID-19. Is that a trend we're seeing locally, and is public health doing any targeted outreach specific to these communities?
Well, certainly it's a huge problem nationally. We are seeing these communities impacted both in terms often of number of cases as well as complications from cases. We are shortly going to be providing a dashboard that actually provides information on race and ethnicity for our cases, so people will be able to look at that. Locally, the most dominant effect is a disproportionate amount of cases in our Latino community. To that issue, we have been really trying to work on outreach to the community. Obviously, there may be language barriers, and so we're really trying to address that and really trying to get information out so that people are aware about what precautions need to be taken and what they can do if they become ill.
We're being told that that a group of people tested positive for COVID-19 in southern Humboldt today, and all are connected to a single cannabis farm. Is that true? And if so, is the farm legal? Are the people testing positive from Humboldt County, from California, from out of state, or from international areas such as Mexico? At this point, do we have a sense of how widely they traveled in Humboldt? Will they show up as if they are from southern Humboldt in the location results the county puts out for COVID-19 tests if they live elsewhere? Can you address your concerns with the cannabis community?
As you know, we don't comment on particular infections in specific workplaces unless it's relevant to public safety. Our recent cases that we have identified in general are under investigation, and I'm not commenting on them specifically. In terms of reporting out these cases, cases are reported out by residents, not by place of employment, and would show up on our geographic distribution in that fashion. The general question of cannabis grows and concerns, it's absolutely of concern for public health. We want to make sure that that grows because they're bringing in people from all over. They have certain challenges. We want to make sure that whether they are legal or not legal operations, that they understand we'd like to work with them. Basically, if they have someone sick, we'd like to be able to help work with them to get people tested and to really just make sure everyone around them is safe. If they do not have individuals who are ill but are interested in doing some screening testing, we would be really happy to work with them on that as well. I think it's an important population for us to keep healthy because it impacts not only the individuals but our community.
In response to this and other factors, do you expect to see a surge in cases like there was when several groups were infected at the end of March, first part of April?
So again, in our previous clusters, we had travel impacting things, and we still do have travel impacting some of our cases. So I think it's an important consideration. And again, we recommend to people that while we're not asking them to quarantine when they return, meaning that they cannot work, etc., unless they've been in really high risk activities, we are asking them to self-monitor for symptoms and to isolate and get tested if they do develop symptoms during that time. I'm concerned, frankly, about increasing cases for several reasons. One is that the state as a whole is seeing a really rapid increase in cases. And because the entire state has some degree of travel, even before travel restrictions were lifted, there's more concern about people coming into the area who've had exposures and may be ill, and our residents traveling outside the area and picking up an infection. So I have concerns on that front. I also have concerns because in our community, we are opening up more, and that is just bringing us into contact with each other more and the potential for increased transmission. And finally, again, as a community, I think people have grown tired of COVID, and I completely get it. And it's summer, and it's lovely, and all those normal things we do as groups in the summer are beckoning, and people want to gather. And gatherings we are seeing across the country are sparking outbreaks. And so, as well as certain venues such as churches and bars. And so I just want to encourage people again that we need to be safe going forward as the risk increases. And so we need people to be masking and distancing. If they're outdoors, they need to mask if they can't maintain that 6-foot distance. Indoors, they should be masking or using facial coverings of any kind. And we really just need to follow those precautions to try and be able to keep moving forward. I really want us to be able to be in a position where our kids are in school, our businesses are still open in the fall, and we haven't had to take any steps back. And I think us embracing all of these things will help us get there.